Hello, listeners of Citizens Voice. You are listening to 98.7 FM. Your host Bangar Reddy and my co-host Dr. NIK NIKAM. And we have a second segment coming up. It is going to be very elaborative discussion to talk about mental illness among the teenagers, especially among Indian American community. Mental illness, especially among teenagers, we are always hesitant. We would like to suppress the information, thinking that would probably impact their future. And thank you, Dr. Nick, really coordinating this, because we are talking about, everything that we bring to the Citizens' Voice is very important, because we talked about, heart surgeries, how cardiovascular diseases are important among, bringing the awareness is important among the Indian American community. And now we talk about, always we are hesitant to talk about. I am telling you, there are so many people I know in the community. I wanted to talk to them directly, but they don't give an opportunity or open it up. But we know some of the things can be cured. That's why we have a panelist here, and I'm very happy to welcome. This is our second segment. We are going to go in very detail, and those who are listening to Citizens' Voice, tune in, go and get your coffee. And those who are driving, happy driving. And this is a very important session. And I am also excited to learn more about, because to start with, and before I give it to Dr. Nick, I want to say one thing, right? Our Indian American community puts so much pressure on our teenagers to do 15 things, 100 things. It starts with 20 things from childhood. Then maybe, when they go to 8th grade, they drop 3. And when they go to, high school, they drop 4. But still they have 10. And imagine they have to spend so much from the homework and other things. And if they are in the sports, they have to perform. And they have to outperform on top of that. Imagine the stress levels that they go through. And our family members will never understand how much stress levels the kids can take. That is one thing. And second is, our parents are so busy, they don't even get to talk to the children at all sometimes. Maybe this is a question to our busy doctors here. They're so busy they didn't even get a chance to talk to children, what they are doing, how they are doing. All they think is there is a bank balance and somebody can tap into. Here is the credit card. You charge it, it's done. So that's the life we are living in, but we need to change that course, right? That's why we are here. And Dr. Nick, please.
Hello, ladies and gentlemen. I am Dr. NIK NIKAM. I am sitting along with Bangar Reddy, my co-host, and today we are going to be talking to two doctors who practice here in the Sugarland and Riverstone area, Dr. Gajwani and Dr. Vaishali, both of whom specialize in psychiatric medicine. And the main topic today is teenage mental challenges. I wouldn't call it illness. I would call it as teenage mental challenges. How do you differentiate normal challenges versus abnormal challenges? And we're going to go through each one of these items in detail and try to get a better understanding of why it is important to, understand that there are some issues that we need to be recognized. What are the early signs and how we can help these people? Unless we reach for help, this problem is not going to be solved. So I would like to welcome
Can you introduce our panelists?
Dr. Gajwani and also Dr. Vaishali. Could you please give a quick introduction about both of you, and then we'll dive right into the teenage troubles.
Absolutely. So good afternoon, Houston. My name is Prashant Gajwani. I am a practicing psychiatrist. I've been doing this work for a long, long time, almost 30 years. And I have seen the devastating effect of mental illnesses. I've seen suicides in my career, and those are very, very hard. My heart goes out to Srinivas, and my prayers for your family. It's never easy to lose a child. I think the burden of a child's death is the heaviest for the parents to carry. So kudos to you, prayers to you guys for doing what you're doing. And thank you, Bangar and Dr. Nikam, for bringing us here on the table. Let's talk about mental illnesses. Let's dive into it. Vaishali.
Yes, hi. It's a great pleasure to be here. Unlike Dr. Gajwani, I do not have oodles of experience, but I did just finish my child and adolescent psychiatry fellowship. I am very passionate about, the topic of suicide and mental health issues in our community, and happy to answer or, chip into the conversation.
Well, maybe let's start off with where you all located. your practice here?
Absolutely. So we work together, and our practice is called Mind Matters Psychiatry. We are in the Riverstone area, Missouri City, and we serve all ages. We have a full-service practice where we have therapists, counselors, adult psychiatrists, child psychiatrists, and we'd like to serve the community. We've been an integral part of the community, and we've seen some of the devastating effects. As Bangar said, this is very common. The pressure on teenagers, I think, is increasing by the day. The requirements to get into a good school, and the schools are requiring more and more in terms of grades and extracurricular activities. And a kid has to excel in multiple ways. And I think that puts a lot of pressure. And combine that with the social norms of living where parents are either unavailable or they're talking on text messages. I think the pressures have increased, and there's not much that we can do to de-stress. And combine that with the stigma of not seeking help. Let me make it very clear. If you have a family member that you think needs help, I would recommend seek help. Don't wait on it. It's okay if you have a false alarm. I'd rather deal with 1,000 false alarms to save one life.
Okay, let's start off with, for example, I had 3 teenagers during my younger years. Now I have 2 grandsons which are in the same position, and I see the same story repeating, the teenage challenges. Can you just start off by saying what are some of the normal things that people can anticipate when they have teenagers who don't want to cooperate with the parents, or want to be defiant, or want to be going in a different direction?
Well, I think it's important to understand where some of that thought process is coming from. Like you said, I think it's a generational cycle. So unless we understand what it is that we're dealing with, which, we can't break that cycle, correct? And I think the world that we live right now is a lot different from how it was maybe 20, 30 years ago, more competitive. Even though the world has expanded in terms of internet, I still feel like it's brought in a lot of isolation. Actually, kids are more isolated now, even though the world's opened up. So there's a lot of those challenges. And like you just mentioned, I think one of the things that Indian parents, or Asian parents, I would say, we love to compare. We love to compare between kids. We love to compare between our lives and our kids' lives too, because we love to say, this is normal, like everybody goes through this. This
we
is
also
a period
compare
of stress.
among siblings, which is even worse.
Right. So those are things that ultimately, in the mom, it's a sense of wanting perfectionism, committing to what we do, and then sticking it out. The options of trying to change our mind or trying to change our path are really not looked upon really well. So there's a lot of those challenges that kind of come into it.
Absolutely. So teenagers are at a very peculiar junction of their life. They aren't fully developed adults yet, and they aren't kids anymore, so they don't know where they belong. They're trying to form an identity for themselves. At the same time, there's pressure on how I look, what my hair looks like, what car I'm driving, what kind of phone I'm doing, what kind of guitar I'm playing. So I think kids have a very peculiar stage of development and difficulties. And then if you combine the economic status and the other issues that the Asian community brings, the family values, and that gets hard for a lot of kids to balance everything. Somebody had defined a teenager brain to me as it's a car that has an accelerator put in, but the brakes have yet to come in. So it takes a lot to raise a teenager. I've raised 2 myself, and it's very challenging for the parents. The commonest question I get from the parents is, my child doesn't talk to me. What do I do? And my usual answer is, you have to go down to the level of the child and talk to them.
Yes.
You can't expect them, like back home, a kid will come touch your feet or greet you and talk to you and be respectful. Kids are respectful in America, but it's a very different way of showing respect and affection. And I think as parents, especially as first generation, you and me that have migrated to America, we have to learn the cultural norms and allow our kids to live with the norms.
So that's the question I have. The first generation we lived in India, and we always compare ourselves with our success with hard work and how we are able to travel. We'll tell those stories to our children, but at the same time, children are going to the schools here, and here the culture is different. The challenges that they face is different. The comparisons are different. And then we want, whatever we did not do, we want our children to do it. As a parent myself, I'm telling, always tries to stay away from it. But, my child right now, she's in 17th and she's applied for the universities. I understand today she has 10 things in mind, just to give an example. So today, for example, she has applied and she has to, submit some essays for different universities because they ask 5 essays for each of them. That's number one. And she has taken some AP courses, right, which means very challenging. You have to deliver every day and you can't miss a single class. That is the third thing. And you have to keep up your health. And sometimes you have to stay late nights. And on top of that, you have these, mom and dad put together a lot of extracurricular activities like, my child wants to be in so-and-so, this, dance, music, and etc. And they have to spend time with their other friends, their birthday parties, and we have our own temple things where you go and sit for 8 hours and we want our kid to be with us. So just why I'm saying is these are the real-time challenges. And question to you, I want to make sure, how do we address this? How do we prioritize and make the kid free and focus on what their top priorities are?
Let me tell you a story, and then I'll let Vaishali answer the question. So I had a very close friend. He lives in Sugar Land, and his daughter was amazing in piano. And the mother and father took her to piano lessons since she was 4. Suddenly she turns 14 and says, I'm stopping piano. Whoa. Parents were devastated, all right, because this kid had done so well. She was excelling at it. And at 14, she said, I'm not going to do it. So this became a crisis. They came to me. And digging through it, I figured out the mom had already paid for annual piano lessons at that point. Mm-hmm. And the first week, the kid said, I'm not doing it. And this was non-refundable, big deposit. So we kept going back and forth. And then eventually I realized we all live vicariously through our kids, right? Things that I didn't get, I want my kid to get. So I asked the mom, I said, how about you? Do you know how to play piano? And it landed up happening so that the mother took the piano lessons in place of child. And this is like 7-8 years out. The mother's enjoying playing piano. She found a new passion. And the kid has gone to Ivy Leagues and has done very well without playing piano.
Oh, and that's
right?
That reminds me of I think it's a poem by Khalil Gibran or kind of a word on how he sees childhood. I think he mentions, your children, they don't come from you, they come through you. So that they are individuals. They are individuals, and it's our job to understand what their individual interests are and kind of encourage and push it in that direction. Of course, you want to expose your child to every option available.
I think as parents, we have never been taught how to take care of children. One of the motivational speakers said that the children may come through us, but they don't belong to our generation. They belong to their own generation. They belong to the next generation. And that's the lens through which we need to be seeing our children. Yeah,
it's that same poem that says you're the bow through which you're casting forward your child as the arrow. Yes. So it's important to understand that they don't have to share your same interests. They don't have to have that same path. I mean, but being a parent myself, and I have a 3-year-old at home, I do understand you want to push them in the direction that you feel would be most successful.
So what is the advice to the parents? Can you give us so that those listeners who are listening, how they can prioritize? Leave it to the child, or where do we really guide them?
I think it's a middle ground. I think it's communication. I think knowing what your child's interests are important. I think understanding your child is important. We all come with our own sensitivities, our own capabilities, and I think it's important to notice those very early on. Of course, it's like you try 10 different stones and you think which one sticks. That's the strategy that most parents go through. But I think it would make a difference if you knew, if you kind of built on the natural proclivity that the child has towards certain things. Like I can see already my 3-year-old, I can shove a guitar in her face or a piano in her face. She's not interested. What she wants to do is run and play outside, which is fine. Then I'm like, then in my mind I'm thinking, maybe I should put her in soccer. Maybe I should put her in 10 different activities. And then you take her to soccer and she's like, I don't want to do that anymore. So it really is a trial and error. It's about understanding that, education is important. I think it's also, we are as a community very focused on the STEM specialties. So we want engineers and doctors, and that's all that matters. Everybody else is not so valued. And so I think there should be a change in the way that we're approaching approaching life, because right now a YouTuber is making 10 million.
Absolutely.
And so there's so many different things that people do. It's important to understand where each kid's natural talent lies and recognizing those and then molding them in that direction. That would be good.
I was making a research for this topic, and I realized that like 38% of the teenagers across the country have some kind of a mental illness. Can you go through some of these common mental illnesses that you come across right? in the practice, and then maybe we can talk about the family pressure, the peer pressure, and how do we diagnose and really help these people? Because there's a lot of support available, but most people don't even get through the first stage of accepting that there is a problem.
So I just want to add one line to that when you are telling about it, what type of cases you normally get. Have you noticed it's already too late, or you think we could have prevented by, if we have noticed the early signs of that?
Right. I know Dr. Nikam was saying these are mental health challenges. The problem is when these challenges are unaddressed for a long, long time, then they go on to become mental illnesses, right? And so the first thing is to kind of see really quickly how they're progressing and try and address it as soon as possible, of course. So the commonest kiddos that I see or like illnesses that I deal with are mainly anxiety disorders. I think it's quite a lot especially in the South Asian community, because it comes from the sense from striving for perfectionism, fear of failure, those things, and that's what anxiety is. It's a fear response that you kind of build up in your head. Depression's pretty common. Another thing that's really common actually in our girls that we fail to recognize is eating disorders, because
everybody wants to slim.
Yeah, so the Western ideals of how a woman should look are different compared to how Indian bodies are. And there's, skin color issues, and that colorism kind of still exists to this day, even in our,
within our own community, because we have so many different shades.
Yeah, we've moved away from India, and we're here, and we still talk about, being fair and things like that. So there's definitely a complex about how we look. Eating disorders is one. The other thing that we commonly see, actually more recently, that I've seen happening more, is substance use. I think a lot of us don't have that awareness because parents are like, there used to be a time where strictly no smoking, no drinking, and it's such a taboo. But kids are crafty now, and then there's, marijuana, everything available in middle schools.
Other than the psychiatrists and psychologists, most, even other regular doctors would not be able to understand, what's going on with their own children, teenagers, because unless you look for something, you're not going to find it.
Yeah, and substance use, again, it comes from a sense of, it's a poor coping skill. It's when your anxiety is so bad, when your depression is so bad, it's when you look for that dopamine hit to make you feel good about it.
So, Vaishali, how do we know that this substance abuse is very new to the Indian American community, right? Especially in the Asian community. Just to talk about itself, we are hesitant to talk. But how do we really recognize the patterns in a child? Is there anything that you can advise? What are the symptoms or things like that?
Yeah, the thing I've noticed in my practice is the more aware you are of what your child is up to, the more you know what's going on. For us, we do have, we obviously pocket our kids into different activities in terms of, you come back from here from school, you have these extracurricular 10 different things, but there's not a lot of oversight on where they're going, who they're hanging out with, what kind of internet they're exposed to. So I really don't think a lot of parents are aware who they're hanging out with and all of that stuff. And then secondly, it's also them not recognizing how kids who are using substances are present as. There's definitely a lot more isolation, more irritability. There's a lot more hiding that goes on that parents are not able to wrap around. They know something's off, but they don't quite know what it is. So there's a few things that you have to look out for.
Dr. Gajwani, you have been practiced for a long time, and what are the things that you have seen?
Absolutely. So the one advice I have for parents is look for changes in your child's behavior. All right. We are all entitled to a bad day once in a while. You don't want to get out of bed. You don't want to do things. That's okay. But if you see a pattern of changes in their behavior, please raise the red flag. the commonest reason, if your kid is doing very well in school and was superstar, and suddenly the child is not doing well, the commonest reason, the first thing to rule out is substance abuse. All right. And I've told parents this, and I'd like to repeat it on the radio. There are lots of FDA-approved urine drug screens that are available on CVS for $15, $20. You can buy one, and you can test your child at home if you're not sure if your child is using something or not. I've had parents who've gone through the room when the child is not there, and they've found these tchotchkes or these instruments that are used for drug abuse. Also keep in mind, what kind of environment are you raising your child in? All right. I've seen a lot of first-generation Indians who've come here, have become very successful, and they partake a lot in parties and drinking and smoking themselves. And then it becomes very hard for you to preach to your child and say, hey, don't do it. And the child will say, but I see this every day in my household that my mother is drunk. So, substance abuse is very common. Unfortunately, it's present everywhere. I think alcohol is omnipresent. You can go to a gas station, to a pharmacy, to any grocery store. There is alcohol available. And most of the college towns, they know that underage drinking is happening, and they look sideways. They don't care about it. I think that's part of the accepted norm in America, that kids will drink and party. So it depends on the value system that has been instilled into the child. It depends on the family value system. But if you're seeing a consistent change in your child's behavior, that's the time when you start thinking, what else is going on? Could my child be using drugs? Could my child be doing something that they're not telling me? And as Vaishali said, communication is the key. And a lot of times, parents lose that out because the kid's not talking to me. Maybe if texting is the way to go, then you text with your kid and figure out what's happening in their life. You have to connect with them. And I've told parents multiple times, you are the best life coach for your children. All right. There's no outside life coach you can hire for a 16 or a 15-year-old. You have to connect to your child. You have to stay connected. And if that means you go on a bicycle ride with them, if that means you're playing baseball with them, things that we quite didn't grow up doing. I mean, baseball and football is a foreign sport to us. But I learned when my kids were younger, just so that I could stay connected, throw some ball outside and get a conversation in.
Yeah, and in terms of communication too, if they know that if I do something wrong, then they're going to come down hard on me and my life is going to be miserable, they're more prone to not have these conversations with you. So if we're able to kind of understand, okay, I'm here to listen, I'm here to help, let's see what's going on, I feel like teenagers essentially are more open to discussing what they're going through a lot more.
So Vaishali, can you expand a little bit on, how do the parents recognize the symptoms of anxiety? And every time a child goes to see a doctor, the word ADHD comes up.
Right.
So maybe you can talk about that one too.
And that also will put some pressure on the child, right? Why am I here and what's happening? And so can you tell how those reactions would be? And and just to that first reactions, the first appointment that comes, maybe after that it will become a routine. But for the beginners, it is a very strange thing that they have to come to and face that, even for the parents and more importantly, the child. Yeah.
My bread and butter of child psychiatry practice is literally kids coming in with inattention issues. So the first thing they will come and say is, I can't focus, I can't pay attention. It's like a child who used to do super well before, not able to focus in class. So, and then because it's the TikTok generation, everybody thinks they have ADHD, so they come in for an ADHD evaluation. But inattention is very, very multifactorial. There's ADHD, of course, that has one type of, inattention kind of, but there's also anxiety that causes inattention issues, depression causes inattention issues, substance use causes inattention issues. So my job when I do the initial evaluation is to kind of distinguish where it is that is coming from. Now with anxiety, some of the common things you will see are the overwhelming fear. Again, and everybody has anxiety. All of us have anxiety. We deal with it at some point. But when it becomes an anxiety disorder is when then it becomes so overwhelming that it's impairing your function. It's impairing how you do at school. You can't sleep very well. So more anxious kids have trouble initiating sleep because they're just lying there thinking about what the next day is going to look like, how their future is going to look like. So they have trouble falling asleep. They have trouble staying asleep. They will, so again, have more possible panic attacks, where they feel like this sudden sense of doom that comes over, particularly before they have a stressor or trigger, like there's a big exam coming up, there's the SATs coming up, something that's coming up that builds up into such a level that you start worrying and you can't sleep or eat really well. So really, those are the common things that parents can notice, is how it paralyzes you into not functioning the way you can normally do. So ADHD, if you think about it now, ADHD is a neurodevelopmental disorder. So it is something that your brain wiring that you're born with. It's not something that will just all of a sudden show up when you're 13 and 14. That's why I find it. Sometimes they come in and they're like, I have ADHD. I'm like, very unlikely that you did not get diagnosed until now. It's probably not, but you still give them the benefit of doubt, because sometimes there are certain ADHDs that fly under the radar, particularly the inattention kind of ADHD, particularly in girls, because girls tend to overcompensate. Girls end up, if it takes an hour for somebody else to do the same work, girls tend to work at it for 3 hours and make it happen. So they have this propensity to overcompensate to get the same results. And so a lot of times parents are like, she's fine, she doesn't have ADHD. They won't know that. But it's a lot of things that you'll start seeing in elementary school. Around 4 or 5 is when you start noticing it. Teachers will bring it up to you. The common ones, the hyperactivity ones, are the ones that get flagged, because the teachers like, I can't have them sit in the seat. They're constantly moving. I can't have them do any work. And they're having behavioral aggression. They're having trouble regulating their emotions. Those things crop up, and those things are caught up very easily. But it's really the other kind of ADHD that kind of flies under the radar.
Dr. Gajwani, Vaishali mentioned about depression also. Maybe you can expand on that one.
Absolutely. We'll talk about it. But what I want to throw in a point here is for our Desi parents, please be open to acceptance. If there is an illness, please be open to acceptance of the illness and the treatment. I can't tell you how many times I have diagnosed ADD in an Indian physician's family, and the parents were completely devastated. They thought this never existed in my family. And just to explain to them, this is a neurodevelopmental thing. It's how the brain is wired. The kid is not choosing to be ADD. Nobody chooses to be ill. It's there, and you have to treat it. And once you treat it appropriately, your kid will flourish and do very well. Your kid is taking 12 hours to do the same work that other kids are doing in 4 hours because of their poor attention span, because of their distractibility. So treating it, accepting the illness, it's an illness, as we accept diabetes, as we accept hypertension. I think, as Bangar initially talked about, the stigma against mental illness sometimes prevents us from seeking help. We think it's going to go away, we'll sleep on it, we'll exercise. One thing we can always do, and this is again generally for all the kids, is try to reduce some distractibility. I think kids have too many things going on at one time and it's hard to focus. I had used this example with my kids that our brain is not designed to multitask. We're designed to do one thing at a time, and there have been scientific evidence that has proven that we can't multitask. We'll lose out on others. So I used to tell my kids, here's an empty shoebox that I kept outside the office, the study room. Put your phone in. Nobody's touching your phone. Nobody's interested in looking at your phone. It's safe and secure, and go inside and study. When you come out or when you take a break, you can come back to your phone frequently. And just try to minimize the distractibility, because a lot of kids will think, I can listen to music and study. Unfortunately, that does not happen. Either you're listening to music or you're studying. You can't do that. And I've had kids who will come and argue with me, no, I can do both the things very effectively. And I tell them, go read up on the literature. Can we do both the things? Can I watch TV and study? Absolutely not. That doesn't happen. All right, changing gears. You wanted to talk about depression.
Yes, before getting into depression, because we're getting into the second half, right? So I just want to tell the listeners, you are listening to Prashant and Vaishali. We are talking about child psychiatry and depression. This is a very sensitive topic among Indian American community. We are very fortunate to have our guests here. You are on Citizens Voice 98.7 FM, and you are listening to mental illness among teenage children. If you have any questions, you can reach out to our studio to 812-777-6874. So before going to how this healthcare insurance works, when they have to come to your practice, can you touch upon before going into our second segment, most of the insurances are acceptable, right? Are there any
Absolutely.
changes nowadays?
Absolutely.
regarding
Most of the
insurance?
insurances do cover mental health. There are benefits. There have been regulations passed federally that allow or they force insurances to cover mental health issues. Most of them will cover, depending on the policy to a certain extent, but they can go for, usually starts with counseling, starts seeing a psychiatrist, medications if needed be. So multiple activities that are available for treatment. Counseling is talk therapy. They can go see a talk therapist frequently, and they can learn some tricks of the trade or modifications to their behavior or coping mechanism on how to deal with anxiety. Right? Anxiety is this unnecessary or uncontrolled fear and worries. A mind cannot be put to rest. A person is not able to calm down. And it's not usually driven by a situation. Yes, they may have an exam next week, but after the exam is done, they're going to worry about something else. Then they'll worry about my driving test. So there's always something that's coming up in our lives. And anxiety always jumps from topic to topic to topic. And often they have catastrophic thinking. They think of the worst possible outcome. Oh, my dad's coming home. Will my dad meet with an accident? My mom's driving. What's going to happen to her health? So anxiety finds different things to worry about.
We have a caller. Let's take this call. Hello? You're on Citizen's Voice. Who is calling?
Hello, I'm Dan. I got a question to the psychiatrist.
Yes, go ahead, Dan. What is your question?
In workplace, a lot of people working with the radio on and disturbs others. How do you think, you said studying and running a radio is not good. In the same way at workplace, if people are running a radio, and how does it affect the work?
Absolutely. A wonderful question, Dan. Thank you for calling in. Workplace is very different than studying for an exam. When you're studying for an exam, you really you're trying to memorize things, you're trying to master certain topics. When you're working, you probably mastered all that you need to do, and you're just putting your skills to work. So often people can get away with listening to some music or listening to radio because it keeps them less stressed when they're working, because work days are usually longer. When you're sitting and doing your homework for, let's say, 2 hours, that's the time you should be really focused on studying only, trying to memorize and master the skills, versus work, whereas you're not memorizing anything. You're not mastering your skills. You're focused, but you're trying to do what you already know about, what you've learned.
Yeah, that's a very good question, Dan. So can I have something that pleases me when I'm doing something else? I know there's a multitasking. I'm listening.
Okay,
Absolutely.
thank
You go to the gym, you put the music on, you enjoy the workout, right? Those music and radio has its value to a lot of places, but not when you're studying for an exam.
Exactly. You don't study for an exam and be on, Hello, who is that? You're on Citizen's Voice.
Hi, my name is Lekha. I
Hi.
had a question about this of anxiety and ADHD in adults.
Yes.
Are there any places that do these type of testing for adults?
Yeah. So the question is, what are the places that parents have to go for, our parents or anybody for ADHD testing?
So
No, it's more
No,
for adults.
adults.
Like
Adults, okay.
plus
So
50 plus old.
So any adult psychiatrist, any psychiatrist is able to do a clinical evaluation and can arrive at, a clinical diagnosis of whether it's ADHD or anxiety. But sometimes when there is a discrepancy and we're not able to iron out exactly what it is, there's always opportunities to do neuropsychological testing. I'm not sure if I can specifically talk about certain places.
Absolutely. So, adult ADHD is hard to diagnose. So, Lekha, that was a good question. In children, usually you get a lot of information from the teachers, from the parents, from the environment. As an adult, somebody can easily read about what are the ADD symptoms, and I want to be diagnosed with ADD and put on medications. Often the treatment does involve controlled substances. So there are testing available for diagnosis of adult ADD. You can go for neuropsychological testing. As Vaishali said, you can see a psychiatrist who can very comfortably make the diagnosis. The diagnosis is usually based on what symptoms a person presents with. And for adult ADD, keep in mind, they usually have a minor form of ADD, which is mostly inattentive type. They may have had it all their life, and they were able to compensate or put more structure in or put more sticky notes on their computer and get the work done. It's only when the training wheels come off, when the child graduates high school, now you're in college, the training wheels have come off. Now you have to do your homework on your own time. The teachers just tell you, all right, finish this reading, that's your assignment, bring it to me on Friday night. And that's where a child with ADD will not be able to compensate when the structure goes away or the training wheels are taken off.
Okay, let's talk about, the
treatment.
The parents are brave enough to recognize their kid is not doing things right and it's not normal, and they are convinced that, maybe they need to seek help, and they set up an appointment with you. And walk us through, what things you look for in these patients, how do you diagnose them, and then, make recommendations.
So
is it devastating to know that a person has a ADHD or kind of, symptoms, or you can, take a, when can we really say that this is more bad, that we need more attention, versus this is okay, this is preventive, we can do these changes to the life and it will be okay on the kid. We want to differentiate between, as you said, calling it illness and a challenge.
It really depends on the diagnosis too. Now, for example, now with depressive episodes, it's unlikely that you will see that in elementary school, right? That's something, you could, depending on, again, if there's trauma or anything like that triggered some of these episodes. But for ADHD specifically, now that's again a neurodevelopmental disorder, like I said, so you will notice something by the time before even they hit elementary school, depending. So, depending on the diagnosis, again, there's also severity. Now, one thing that I always struggle with in terms of South Asian parents is when they come in and we discuss treatment options, in their mind, they've been told that, okay, if you have a mental illness, it means you'll be put on medications. It's not necessarily true. Not all mental illnesses have to be treated with medication. There's a completely different kind of treatment modalities.
Lifestyle sometimes. Yeah.
There's a psychotherapy that you can try, depending, again, if there's a mild to moderate case of depression or anxiety, that's what we would start with, because for children particularly, we are cautious about putting them on medications. It's not like everybody that comes in, we're going to throw a pill at them and say, okay, life's going to be different, because it's not magic. You can't just take a pill and feel happy about things or your life changes, because ultimately your goal is to still do the work, which is in therapy, which is trying to understand why we think the way we think, how we can change some of these things, how we can change some of our behaviors, and that happens in therapy. So for a lot of times for kids and adolescents, the treatment is behavioral therapy, cognitive behavioral therapy and other kinds of therapies that are something that they can choose to do before we can escalate up to medications. And particularly with ADHD too, depending again about what kind of ADHD you have, I always like to tell parents, when you have a kid with ADHD, like regular parenting kind of goes out of the window, right? You have to be a super parent at that point, because what happens is your regular parenting skills, they don't necessarily translate into action. For example, it's known that ADHD kiddos, they respond more to positive reinforcement rather than punishment. So a lot of times if we kind of say, oh, if you don't do this work, we're going to take your stuff away, they don't respond so great to that. But they respond well to positive reinforcement. If you say, if you do this, this is what you're going to get, that gets them more motivated, because that's the whole point, is to stay motivated. And even then, I don't think the rewards have to be money or food or anything like that. The reward could be time. You can, say, okay, if this child likes screen time, they'll get maybe 10-15 minutes extra. And then on the weekend, if you want to, reward that, you say, hey, you have one good week, I don't hear complaints from the teachers. What we can do is we can go out to the zoo or spend some more time with them, an activity with the parents that would give them incentive ultimately. So a lot of times with ADHD, the first line treatment, especially the younger the kid is parent management strategies. Like you actually have courses for parents, because that's what it is. Parenting would have to change for the kid more than the child themselves. And the medication part, of course, comes in handy to help them get to where they need to. But schools are another important source. Like, for example, if you have an ADHD diagnosis in this country, now you have 504 accommodations and IEPs and like psychologists at school that will help you come up with an education plan, because these kids learn differently. Like I said, it's a wiring issue. So because of that, they learn differently. There are a lot of kids with ADHD that have, they learn really well with visual cues. So they're good visual learners. If you start by rote telling them something in class and teaching them, they're less likely to remember it, but they're really good visual learners. So schools have to accommodate by law. They are required to give the child the least restrictive classroom, which means it's their job also. So parents think, sometimes they feel alone. They're like, oh, okay, this child is going to get on medication and this is how it's going to be. But I know physicians who have ADHD, some of my colleagues who will have their ADHD accommodations go through up until they take USMLEs and after. Like, so it's something that, something that it's, once you get into the system of getting these accommodations at school, and there could be something as small as the child will sit in front of the teacher, or the child would have, extra time for assignments, or the child would have an extra reminders for assignments, things like that. That school's supposed to do those things. So there's other ways to deal with it.
And this is very interesting. I think we're getting a lot of calls. So you are on Citizens Voice. You are talking to Dr. Vaishali, Dr. Prashant.
Yeah, hi. I would like to know that the teenagers these days are having more screen time, either phones or anything. So it's becoming so much challenge to the parents to control or monitor or convince them to minimize their screen time. So what are the best tips or the ways we need to approach as a parent to convince the teenagers?
You got the question?
Yeah. I like to tell parents that
parents' problem.
No. The thing we have to understand is, I think kids should understand that a phone is a privilege. It's not a right. I don't think people really get that.
Absolutely
people
right.
think it's a right to own a phone, like every teenager.
Sorry, it got dropped. Yeah, but we'll be talking. Yeah, go ahead.
Yeah, so the idea is that a phone is a privilege. It means if you're living in my house, these are my rules, and this privilege is given to you if you follow some of those rules. And I'm not trying to be like a strict disciplinarian, but essentially people need to understand that this, whatever this is in your hand, it's not something you necessarily have to do. It's not a birthright. It's not food, water, shelter. So it is something you have to regulate. There are many apps.
But how do we do that? Myself has the same question, right? So everything that nowadays we can do on the phone. It's a smartphone,
right?
And a student probably working on some of the college related, and sometimes they'll come, Mom, I need to work on this. This is important, and this is where I have to do this, and you cannot stop me. And nowadays everything is on the technology, and so sometimes it is a good to have it, and it's sometimes it's really a punishment for us.
Yeah.
And I see many times it is distraction, and I see that many kids. At the real time, I noticed is they try to do the homework quickly in fight, as doctor said, because if you tell them don't do multitasking, they just finish it, write that paragraph, and go back to their, putting time on those playing games and other stuff. So how do we really teach them, coach them? My question is how to coach them to see the big picture that, as you said, this is not a, right that you have.
Yeah, so I think structure is important. I think we need to know, okay, during school hours, obviously they have limitations, but when you come back, how many hours do you need it? And also, it's very, very important to have good sleep at night for teenagers, because a lot of the stuff that goes on, a lot of mental illnesses, sleep is a huge, huge factor. So if your child is on the phone up until midnight, they're not doing any work. There's no absolute reason to suspect that they're working hard until midnight, burning the midnight oil on a school day. So that's a red flag for you immediately. You're not doing something right there. There has to be a structure for screen time too. Screen times have limitations. There's multiple apps that will shut down social media and things like that after a specific hour, 8 or 9 p.m. And it's important to get those screens away 2 hours before bedtime. So if you want your child to be asleep, okay, you have a teenager, maybe in high school, maybe they want to go to sleep at 11. kids do have something called delayed sleep-wake cycles in teenagers. What happens is they are unable to fall asleep until late and wake up early. I think there were certain laws that were designed to make sure schools start after 8:30 just for this reason for high schoolers. But it's important, if they want to go to sleep by 11, by 9 o'clock period, they should stop being on their phones. I don't think phones are helping them do their homework.
Absolutely. Screen addiction is a real thing. Yeah. Keep in mind, if your kid is overusing the screen, it's upon parents. Yes, it's going to be an inconvenient conversation, but it needs to be had. Personally, what I did when my kids were teenagers is I would take the Wi-Fi out. You can train your Wi-Fi, or there are all these smart Wi-Fis now that you can program it to say, all right, it's going off at midnight and it's going to come back at 8 a.m. There's really no reason for a teenager to be on the screen at middle of the night. Usually that's when they may even get into the wrong company, or they may see things or do things that they should not be doing. So I think it's a good habit for parents to draw a line and say this is a privilege and you can have it, and we all learned to adapt to it. When my kids were in middle school and the teacher said, all right, you can start doing your homework on smartphones. I was shocked. I was like, oh my God, my kid's only 12 and you want them to have a smartphone. And every kid had the smartphone, and we learned to live with it. But then we learned, all right, the Wi-Fi can be, dimmed out, or it can be tuned out at night. And so they really can't be watching movies or other things if there's no Wi-Fi working.
Okay, let me ask you, in what conditions would medications be necessary? And also, how do you assess the progress or lack of progress in these conditions?
So you'll notice it in the child themselves. Again, it really depends on what problems they've come with. So the way we usually gauge in terms of treatment responses, I really, again, I'm a huge believer in good sleep. So when I start to see that the child is getting more rest and they feel like they have more energy, that they're feeling less tired, that's a good sign. The treatment's progressing well. When they are feeling less hopeless, less guilty, more engaged into thinking more future-oriented, that's a good sign. Because again, when they come off to you and they feel like there's no hope, this is how my life is going to be, there's nothing else that's going to change. And that changes as you're doing more therapy and you're taking the right kind of medications. Those are the things that I look for. Appetite improves, they're eating better. I think the isolation decreases. Usually they just don't want to be bothered. That is typical teenage behavior. They want to stay in their room with their computer. But it still improves to a point where at least, you can come and have a meal. You can have dinner with us. You can hang out with us outside of, school on weekends and still feel like you're engaging well. And they're a little bit more social, wanting to be outside. Those are some of the things that I think are helpful.
So those are very important points to see, if the kid is making progress or, right. or not getting anywhere.
And the grades improve automatically because they're feeling much better amongst them.
And keep in mind, not all behaviors require treatment. Right? Some behaviors are very normal. If, I've had parents who brought a kid in. Both parents were executives and they were working long hours and they didn't get home till 6:37. The kid was doing after-school program. After the kid came home, they just wanted to run around and burn their energy. And parents were exhausted. They wanted the kid to sit quietly, keep their elbows down and eat dinner. That wasn't happening, and the parents would bring the child in. And you just have to explain. I think you need somebody who specializes in the field to actually look at the behaviors and figure out where the normal stops and where the abnormality begins. And I think that's what we as psychiatrists are very well trained to do that. And sometimes it's just normal behavior. Kid's going to come home and they're going to run around and be happy and jump around, jump on their bed and, just have fun.
Like my grandson says, I put 10,000 steps. It's only 3 o'clock in the afternoon. And they said, yesterday I put 15,000 steps.
Yeah. And another, we are talking very good about teenagers, right? Issues with the teenagers. But coming back to adults, imagine a family who has, depressive symptoms and living in a very difficult situation. And that would be very impactful for the kids
Absolutely.
Going to the school and the families around. So what is your take on that, Prashant?
So depression is very common, all right? Yeah. It's very prevalent. A lot of people, when they start experiencing depression, they don't seek help. They say, I'm going to eat right, I'm going to sleep right, and it's going to go away. So you cannot cause depression and you cannot will it away. All right. Depression is caused by genetics. It's caused by the environmental stress. There are multiple reasons why a person experiences depression. But clinical depression is when you've had symptoms of about 2 weeks or longer, feeling sad, not having enough energy, losing interest. Depression is also one of the very common illnesses, but it's also one of the most treatable illnesses out there. There are lots of medication options. There's lots of therapeutic options. For mild to moderate depression, you can see a talk therapist, and that's going to help you. If you have moderate or severe depression, see a psychiatrist, get on medications. That's going to help you. And there's newer and newer medications coming out. I'm very excited to report that the field is developing enormously right now, and there's a lot of focus on it from the forces to be, and there are better treatments coming out. There are more tolerable treatments coming out on a daily basis. And treatment is one of the most treatable illnesses, but yet at the same time, we're seeing an enormous increase in the rates of suicides. All right, just tying in with Run for Jeev that we have coming up. There are 40 to 50,000 people in America that kill themselves every year. And that number has continued to increase year after year. And often it's a combination of not seeking treatment. Often it's a combination of I'm going to drink myself out and that's going to help me, or I'll use cocaine, that's going to help me. Drinking cocaine is going to help you for 2 hours, but beyond that, you're going to feel more depressed for 22 more hours in the day. So seeking help, getting to the right place is very important, and understanding that this illness is just like your back pain, it's just like your headache, it's just like your asthma, it's just like your diabetes. It's treatable. You can live a very good quality of life. It can help you deal with the challenges of life that come your way, whether those are financial, family, employment, etc. If you're not depressed, you tend to make better judgments and deal with the problems of life much better.
Okay, going back to the teenage challenges, how much psychotherapy is needed for the parents, especially the Indian parents?
So I think part of treating a child is actually, that's why it's so challenging to do child psychiatry in general, is because you're not just treating the child, you're treating the whole family.
That's why.
That's where
in fact, I did a interview on autism.
Right.
Then I realized autism is a family problem. It's not just one kid's problem.
Right, and so it's really a lot of it is parent education, and it's trying to explain to the parent why they, how to deal with it.
Maybe they need some guidelines and tips.
Yeah, right, and how to recognize, how to support, because even a well-intentioned parent, depending on how they grew up with in terms of how available their parents were, they might not have the skill set. So I do think they do rely heavily on professionals, which helps, and I think that's where it comes, is having the conversation and be like, okay, what do I need to do to be present for my child, and how I can modify. Those are the good the parents that I like working with, in terms of, they're easier because in that sense.
So we need a behavioral change even in the parents.
I think so, yes.
Yeah.
I think
for that, Dr. Nick, I believe not just with,
yes.
So first it starts with parents. As you said, parents have to change first to accommodate the child needs and give the comfort.
Right.
And the second is, of course, the child has to cooperate, the patient, we call it. Or the whoever is having the challenge. And third, I think, is the siblings and the family around it and the neighbors. Sometimes, nowadays you have this bullying and all. We didn't even touch upon that. Yeah. And that will add more pressure that why people are looking at me differently and why I am treated differently, or why somebody is not friendship. And even kids will sometimes they talk. I want to have only friendship with these 2 people, not with other 5. This was not an issue back in India, right? When we can deal with anybody. That's the second. And more importantly, which we did not talk, is the community support. That's why this walkathon, we just heard about it. I think community awareness is the most important thing that we should come across, because otherwise the Indian, American, Asian community is really forgetting. We are very successful professionally in our careers. We made our fortunes, but I don't think, we are focusing more on our health, especially behavioral health.
Yeah.
And I would like you to talk, both of you, on that, because we only have 5 more minutes. Yeah.
I think mental health translates into good health overall. I think stress is a major killer right now. I think, a lot of times we don't realize the more you equip your kids to deal with it, the more they're able to get better. So, because you see now, random cases of very healthy individuals, they can be high achievers at 40s, and before they hit 45, they have, heart attacks and strokes and things like that. And it's stress. It really is. And if we can't equip them to really learn how to cope with it, I think we're setting them up for failure. As much as you think academic success is the only success, I think we have to start looking at it holistically. Mental health is physical health and vice versa. So, yeah, I think it really, really is important to have a dialogue. There's so much stigma, for sure. Of course, there's stigma even in general for psychiatry illnesses in here or anywhere else, but more so in our communities. A lot of times parents come in, it's hush-hush, nobody else in the family knows. Because I have had, this is so common for me to go to work every day, and when I ask them, oh, do you have a family history of depression or anxiety? They're like, maybe, I have maybe some of these cousins that have this, but they don't tell us, so we don't know. So I don't know. Yeah, maybe there is a family history.
Absolutely.
I have no idea because nobody talks about it, because you don't want your uncle or even anybody else to know what your child is going through. Everything is hush-hush, everything is quiet. So we're not able to know exactly what
The
true
big picture.
information, the true picture is.
Yeah.
Understanding and
About the
accepting.
family,
Understanding and
about the
accepting.
community awareness.
Absolutely. So community awareness, understanding and accepting mental illnesses as illnesses of the brain. All right. This is not a characterological flaw. It's not because you're lazy, you're not able to do things. It's because you're depressed, you don't have the energy, and you're not able to do things. So understanding the illness and accepting the illness is the biggest part. And if somebody's ill, then it affects the entire family. It affects the society at large because they can't go to work. They're not able to attend their kids' functions. It's very burdensome for the whole family and society at large. And we have some very effective treatments that are available. So I would like to encourage anybody that's listening, if you're having symptoms or you know of somebody who's having symptoms, please encourage them to seek help. There are good treatments available, and your quality of life will get better. The quality of life for your entire family will get better. And please don't let the stigma stop you. All right? This is just an illness of the brain, just like you have illnesses of the heart, lungs, pancreas, etc.
I think sharing stories of successes after dealing with depression and anxiety is super important. Like when you have somebody of a high stage, like, maybe a Deepika Padukone or some of these actresses talking about depression.
Oh, even the
like
cricketer Jemima
Recently,
Rodriguez,
yes.
and she came and expressed her struggle with anxiety,
When
and she's the one who put India on top of the world cricket.
Right. And so it normalizes that conversation to be like, even if you're in that stage, you're able to open up, have these conversations. I think it's important that if families are dealing with it, not to like hush, keep it down, but be like, okay, this is going to happen. This is going to be something that we'll deal with, and you're going to come out stronger. And that's good, could be a story, so everybody else can seek help.
You
and
said
be
it
more
right,
open about
Dr. Vaishali. It's more important to talk about the successful stories also, so that people see that, hey, you are suffering with that, but there is a path there to reach there. Look at these celebrities, and look at a lot of people, right? In the movie stars also, some of them suicidal and all that. So I think it is very helpful to share the successful stories so that people can relate. But I think going back to Indian American community, see that there is a stigma, as Dr. Prashant mentioned. People are hesitant to talk about it. But I think time has come. The Indian American community, everybody should understand and should prioritize and give time to the kids. That's where we started. And also, more importantly, look at the treatment options and identify those challenges in advance and take it to the doctors. And more importantly, one good news is we have, psychiatrists available who are very much understands our culture. Absolutely. That is also another important thing, because if you go to an American psychiatrist, I'm not saying they don't know, but they don't know, because a lot of things we hush.
Context,
Right, context. Whereas American families are sometimes, I'm not saying they're very open-minded. They will tell everything to you probably, but our parents would try to suppress everything, right? So I think it is also important to pick the right doctors. That's what also I noticed. And talk to them, be comfortable. And if you are not comfortable, you can always change to a different person, because it's your life, it's your child always, right? So closing comments, we are almost at the top of the hour, Vaishali. and then Prashant. Yeah.
I guess I would just parrot the same thing again. For me, as far as I'm concerned, mental health is physical health. It's the whole body, mind and body that we have to keep in mind. And I just hope there's more dialogue around it. That's the only way we can. I know there's a lot of chatter about, okay, everybody has mental health. That's all we talk about now. But I think it's really, really important that we need to continue to do it.
And a very heartfelt thanks to Bangar and Dr. Nikam and Masala Radio for bringing us here and talking about this important topic. I think this tells us that we are practicing what we preach.
Let's give out your clinic name and location.
Yeah. Absolutely.
And
so
contact number.
Mind Matters Psychiatry. We are in Riverstone, just at the junction of Highway 6 and Riverstone. The telephone number is 281-778-9530.
Vaishali and Dr. Gajwani, it's been an enlightening conversation about the awareness of teenage challenges. I have done this a couple of times before, and as I said, I've done on autism, and these are all actually like a family issues, and I think it's very important for Indian parents to open up and realize that, if your child needs help, seek help, because it will help the entire family.
Yeah, thank you, Dr. Nick. This is a very, very, very productive conversation, very enlightening for the parents who are listening. Thank you, Vaishali. Thank you, Dr. Prashant, for coming. We want you to come back.
Absolutely.
Because this is really, parents don't want to talk about it. Parents always talk high about our kids. We always put other things under the carpet. And moving in the community, I see those symptoms. And thanks for coming and taking your time, especially to give importance to psychology, which is a forgotten, especially depression is forgotten challenge or illness we call it. But I think fortunately we are in United States, which is available. Doctors are available. Take advantage of it. Call Dr. Prashant or Dr. Vaishali. They are in our community. They are very helpful. I greatly appreciate, your time for coming here.
Can you take our picture?
So thank you, listeners. Thank you again. We'll come with more information on Citizens Voice 98.7 FM every Sunday 4 to 6 p.m. Your host, Bangar Reddy, co-host Dr. NIK NIKAM. Thank you once again, Dr. Prashant, Dr. Vaishali, for coming here and sharing the great information, that we really needed. And we come back to you with more information next week. This is Citizens Voice